So I'm gonna show some assessment. This test is called thumb ulnar collateral ligament test. So if you can see, I'm pressing on the Thenar eminence and pulling valgus downward for the thumb. The pain is cause positive that you have UCL. The next test is called the thumb grind test, which is you need to mobilize with the wrist or the Thenar eminence. And if you can see, I'm doing circular motion for the thumb. If you feel pain, that is positive that you have osteoarthritis on your thumb. Hello, good day. This is Imelda Garce, your RMT and DOMT of Canada. So this video is a continuation of the video of Angelina, that she have a swelling and painful on her thumb. If you can see what she said, that her thumb, sometimes she put the bandage or tape to straighten it because it bends. So the metacarpal, it bending because we have a tendon on each part of this and it pulled down. That's why it like this, it can be straight because it's pulling. Why is pulling? Because the attachment of the muscle on this forearm is tight. So this is, I can help. If she's near to me, I can help 100%. Her thumb, like me as a massage therapist, I always using my thumb. That's the reason my client feel good because I'm using this, right? But if I'm not therapist, for sure my thumb is very bad right now. So the part of this muscle is called the flexor pollicis longus, which is from the tip of this thumb towards down to the middle of this wrist and upper that. If you can move this thumb like this and you can touch this, you can feel it moving here because the attachment is until there, right? So it means once anything that you have problem, that muscle that connected is you need to treat. Now, because I'm far from you, once your swelling is gone, and even though you can feel a little pain, as long you're doing the assessment so that we can figure out by helping me what is the cause or problem of your thumb. But this time, the thumb is always using, like me as a massage therapy, I always using thumb, and it causes fatigue and tightness on this area. This muscle is called flexor pollicis longus, which is from the tip of the thumb until down to the middle of the radial part of this thumb and until down. If I can put my hand like this, and if you can bend your thumb like this, you can feel the motion until here. If you can action your thumb, you can feel the motion until here because that is the muscle when you're doing action. So the treatment that you can do for your thumb to have relaxation and treat, if you can press this and moving your thumb most of the time, like doing this 3 to 4 minutes every day before or you go to work and after, before you go to bed. If you can doing this, called the static pressure with active motion. So this is very helpful for if you're doing 3 to 4 minutes twice a day before you go to work and before you go to bed. Angelina, because we always using this thumb every day, so I want you to give some exercise twice a day. And then, if you can give some massage from here, I can show you. You just do some circular motion on this area, and especially your thenar eminence muscle, this one. You can do this circular motion, do this, and sometimes you give some mobilization, like if you can pull your thumb, pull like this, distraction of the thumb. So when you pulling and then you moving up and down, up and down, up and down. That's called a mobilization for the thumb. If it is painful, then stop. Once you're okay, then do it again. Once it is pain, then stop. Anything that pain is caused, always stop. Always stop. What are you doing? Just put on ice, let it numb, and once it numb, put a warm towel. Because it's a chronic stage, so you need to combine the cold and hot treatment. So first, once your thumb is painful, put on ice, let it numb, and after once it numb, put a warm towel. It's not cold, it's just like a little hot, and you feel some different. And once you have a good hand now, no more pain, I give you advice from hydrotherapy 3:1. 3:1 means 3 minutes and 1 minute. So the hydrotherapy is just, you can prepare 2 basins of water, 2 basins with water. The first basin is hot water. And if you have Epsom salt, you can put Epsom salt. But if you don't have Epsom salt, it's okay. Just a little hot, then let it warm until you can soak your hand, until you can manage the warm. It's not cold, a little warm. And let it stay your hand for 3 minutes. Until that, you prepare another basin for cold water, which is, if your place is very cold, or put an ice on it and put for 1 minute. That is combination, because it's a chronic stage. It's a combination of hot and cold. So anything question, just free to ask. I'm here, your therapist, to give you a relief pain. Thank you.